So in this video, we're going to go through the key things to understand and expect after a hip replacement, all the key questions, the absolute important things that you've got to consider when you're going through a hip replacement procedure. So let's get stuck into it now. And now anybody that is considering having a hip replacement understands that this is it's a big decision. You know, it's a worrying decision. It's normal to feel a little bit apprehensive, a little bit reluctant to do it, but this can be life changing. This is a procedure that can really enable someone to thrive. You know, you're talking about someone who's got a potentially very severely arthritic hip with high levels of pain, quite a bit of disability through an inability to be able to do exercise and function day to day, and a hip replacement procedure can be the thing that really enables them and changes their quality of life. However, having said that, there's a big decision here, and that decision also needs some due diligence, and the due diligence behind that is when a patient wants to understand some of these key questions that we're going to go through, and also trying to understand what it's going to look like afterwards, because it's hard to know that. You know, you might be with a surgeon in an appointment room for quite a short period of time, or you might just not have had the chance to ask these questions. And it's really important to understand, what is it going to be like once I've had the replacement? What am I meant to expect? What's normal? What's not normal? So we're going to dive into this now. Now, the procedure itself is the same, but the way that it gets done can be slightly different. You've got some surgeons who do anterior replacements, where they kind of come through the front of the hip. You have some surgeons who do it from the side, some minimally invasive, some with even something that's called robot assisted, where the robot essentially is utilized to map out and essentially measure and really refine and finesse the structure and placement and the sizing of the prostheses. Now, all these things vary. Ultimately, the outcome is going to be the same. This is about speed of recovery ultimately, and really mitigating anything going wrong. Now, having said that, more often than not, patients will go into surgery, they'll come out. The last thing you're going to want to do is get up and start walking. Now, from a physio's perspective, doctor, nurse, whoever it may be, anybody on that ward knows that the first thing that we want to get you up doing as soon as possible is walking, is weight bearing. And that's really, really important. So if you've just had that hip replacement done and you've got someone coming into the room asking you to get up with your crutches, with your frame, with your sticks, asking you to walk, that's normal. If anything, it's essential. The less you're in bed laying about, the more you're up and about walking, it's better for the hip, it's better for the joint, it's better also cardiovascularly, because it reduces the risk of any other clotting and embolisms and things developing. So the less you're laying about dormant in bed, the better. But look, you need a bit of rest as well, right? It's a bit of a balance of these things. So you're going to get up and about, you're going to get walking as soon as possible. And you're not going to be allowed to go home, 1, until you've opened your bladder, 2, until you can walk safely, and really 3, before you kind of have to learn how to do stairs, right? And this is the old adage of good leg up, bad leg down, and that's when the physio is going to help you doing that on the wards to then get you home, so you can be functionally as able as quick as possible. However, you've got to be safe. You've got to understand that using your sticks and your crutches at home and getting rid of them as soon as possible is not a determining factor of is someone doing good or is someone not doing so good. In order to get to the point of needing a hip replacement, you've probably been in pain for a while. The hip has probably stiffened up for a while. You've probably lost an ability to exercise and move for quite a period of time, meaning that structures around the hip are going to be deconditioned. Structures around the hip are going to be weaker. So it requires the physio in particular, the patient in particular who is fairly new post-op, to really consider the fact that walking with quality is absolutely key. You don't want to rush off just because your mate down the road got off the sticks after 2 weeks. Time it, take your time, and use it to walk safely. Because the fundamental priority at the beginning is being functionally able and being safe. Now, in order to do those things, it's absolutely fine to take some pain relief. I think patients are fearful of taking pain relief through the fear of masking their pain, and if I can't feel my pain, that what if I damage it, what if I make it worse? It doesn't work like that. These drugs are there to enable you to be able to move, to be able to exercise, and to be able to recover. And those things are really, really quite key. Now, how you take the drugs, what drugs, that's obviously contextually specific to your situation, but don't be scared to use them. But don't be dependent on them either. So it's a balancing act with these two things. The first target after that is obviously to come off the sticks and to be mobilizing and walking unassisted. And that includes walking in the house, that includes walking up and down stairs. This hip is absolutely solid. This hip is robust. It gets tested, and if it gets done well, there'll be absolutely no risk. Well, no risk is probably remiss. There'll be a very, very small risk. But where the risk does come into play is when people are fear avoidant, when people are cautious to move, when people are a little bit too anxious. That slows recovery down, and it starts to feed into this fear avoidant behavior. So trying to be confident is key, and confidence plays a massive role with these patient groups, and in particular in those early stages, because your brain is telling you one thing and all of us in healthcare are telling you something else, and you have to listen to those advice. You have to consider these things, because the sooner you can get these things optimized, then your recovery is going to be optimized. And it's such an abundance that you can do afterwards, but you need to start bridging the gap in these early stages. So let's say, for example, right, you've come out of hospital, you've come off your sticks, you're walking a little bit better, you're taking your pain relief, but your pain is starting to be a problem. You're starting to say, you know what, it feels uncomfortable, it still feels painful. That can be completely normal. You have to remember the fact that this hip has likely been a problem for a while. Just because someone's taken the old one out and put the new one on in, it's not going to immediately resolve all your issues. It will take a little bit of time, it will take a little bit of perseverance, and it is normal to have discomfort and pain post-operatively. Now, obviously, there are certain situations where you don't want it to become a significant problem with things like infection and dislocations and things like that. But often in those scenarios, it is very, very rare. The common post-op pain and discomfort that you may get is absolutely normal. And that's why the pain relief is so key. And that's why physio and rehab is absolutely imperative to enable someone to be able to get back to recovery. Now, one of the things that often gets asked is about hydrotherapy. So like using a swimming pool, and that can be really beneficial, but not everyone has access to it. But let's say you do. Let's say you've got access to a swimming pool, you've got access to being able to get into water. This is a great opportunity to be able to loosen up, free up the joint and get you moving, and also make you feel confident. But you've got to consider the fact that the wound's got to be fully closed. You've got to reduce the risk of any kind of infection. All those things are important things to consider. But being able to get into a pool, getting into a hydro center, or even being able to get onto a bicycle, like a static bike, can be so effective at getting the joint moving, getting you moving, and really enabling rehab to consider, or for you to consider within your rehab, it as a really important and vital tool to use. Now, one of the other things also people often find difficult in those early stages is sleep, because you struggle, you can't sleep on that side. Obviously the wound's there, like you can't press on it, you can't push on it. That can be quite uncomfortable, and no sleep or impaired sleep is an absolute torture technique. You know, anyone who's got a kid will know it's absolutely savage not being able to sleep. So you've got to make sure that you find positions that are comfortable, and in those early stages you have to be sensible, but you also need to not worry and stress about it, because you laying on your back and then turning around and waking up with your hip on top of the other, look, it's gonna happen. You're gonna move when you're sleeping, but it's normal for your sleep to be impaired. So that's why if there's something that you're going to struggle to control, like sleep, you're going to have to try and optimize every other option as much as possible. And anyone who's had this surgery will know that you're all going to have your own little nuances and difficulties that you probably come across. And look, share a comment below and write some of the key things that you've struggled with post-op, to see if there's a common theme, because a lot of these things will resolve and improve with time, with rehab, and really with kind of a really specific approach to understanding that outcomes can be fantastic, but initially there's things that we have to do in order to bridge the gap from the early stage post-op into those latter stages of rehab, and in particular for those that are wanting to get back to a higher level of activity and exercise. There's a lot that we need to do. Now, if you're planning for the surgery and you're listening to this and you're thinking, okay, look, I feel like I'm getting a little bit more prepared. One of the other things that's always worthwhile doing is discussing and looking into the opportunity to do preparation beforehand. So things like prehabilitation can be really effective. Now, prehab isn't just this, and this is almost prehab. You know, educating yourself, understanding what's going to be going on, setting those expectations is part of prehab. But also, it's about trying to make your hip as physically robust and as physically resilient as possible to enable it to be able to get ready to what you're going to be putting it through. However, what you've got to consider is this hip may not have moved in certain positions for a long period of time, meaning that the joint stiffness has and would have led to muscular deconditioning. So you cannot utilize these muscles through all the ranges because the hip joint won't want to move. So pick some specific and simple exercises that you can utilize that doesn't provoke your pain too much, that you can keep at doing consistently day to day, and really making yourself as physically resilient and ready for the surgery as much as possible. Look, I hope you've enjoyed this. There's plenty more to come, but comment with your thoughts and your experiences, and let's build that community here so people can see and learn from one another.